Orla. Minister, I think there is something a little bit sick about a situation where we're here discussing a proposition to allow GP cards for children under 6 in the context of a backdrop to all of our offices being inundated from parents of children who happen to be slightly older than 6, maybe teenagers, who are the victims of the most appalling illnesses or disabilities, but because of their age and because of the government's changes to the discretionary medical card system are being denied the medical assistance that they so desperately require. And when the issue was raised at Leaders' Questions yesterday, Minister Noonan sort of laughed it off and said, do the deputies on this side of the House want everybody to be having a medical card, as if it was some sort of an outrageous proposition to put forward, when in reality the idea of universal health care for all citizens as a right based on medical need and necessity is something that we should be all fighting for, and that is something that should be funded through a progressive taxation system rather than a discretionary scheme which discriminates against people because of their financial means. And I do think that I would like to put on the record my support for the parents who launched the Our Children's Health petition and campaign yesterday, and who are demanding amendments to the Health Act of 1970, whereby every child, not only people who are under 6, but all children, particularly those who have been diagnosed with serious illnesses or congenital conditions, would be entitled to not just a GP visit, but a full medical card based on their medical need. And I think that's the issue that's urgently needed to be addressed, and in some ways the government's proposition on this issue has been viewed by some as a bit of a stunt against the backdrop of the situation that many very seriously ill children are in. And I just want to give the example of a child who happens to be 7 years of age in my own area, and this child has had a number of operations since her birth. She was diagnosed with infantile scoliosis. The family had had a medical card since '09, even though both parents were working and continue to do so, and they were around about the threshold. Last year, the medical card was taken away from that family at the time when the child's health was deteriorating, and when her consultant recommended that she needed a back brace and other medical assistance. The family applied for a medical card just for the child and were refused because of their income. They spent basically the last year, as well as coping with the illness, trying to deal with that, and the whole issue has been completely and utterly demoralising for them. And the father, in an email, said to me, and I actually find this heartbreaking, he said, if I gave up work, the system would look after my family health-wise, but by working, maybe I'm doing undue harm to my daughter by not being able to provide for her medical needs, which is a terrible thing for a parent to have to say. Now, we urgently need to address this situation and to address the issue of access to GP care, absolutely, for all children and indeed citizens, I would say. But the other deputies who've spoken have already highlighted the fact that there have been, from the very beginning, huge difficulties with this scheme. A lot of kickback from the GP organisations, and I note that you've said you've sorted it out with them. We'll see, right? But I mean, you'd have to pose it in the context of this has been going on for months now, and here we are with the debate starting at the 11th hour. We hear that people are going to sit down and talk about it, but we have to kind of step back and say, how come the medical profession, which you would imagine is only concerned about looking after its patients, building up their practices, doing a good job, would be driven to a situation whereby they have to organise big public meetings, major email campaigns, and be hounding politicians for months to actually get heard? There's something wrong somewhere along the line in that regard, and I really hope that the heads of agreement, or whatever it is, does sort the problem out. But there's a huge amount of issues to be addressed, and you would have got, as we all did, Minister, correspondence from a number of GPs, the one of whom I just want to deal with, and this is a person with a practice whereby their assistant had to leave the practice, was emigrating because the stress of the job was too much. That GP practice couldn't get anybody else to fill the vacancy, not uncommon. And they tell the story about how one of the factors that pushed them into a decision to emigrate was the reason and the idea of this GP contract for the under 6s, which this doctor, who was qualified and operated as a GP for 4 years, basically said that it was the proposition that your department put forward forced her to decide to emigrate. And some of the issues which she highlighted in the original contract, which I hope that your talks which have been agreed are going to sort out, are issues like where she said the scheme, as you were proposing it, asked her to do work that she said was scientifically discredited, like screening and measuring well children, that it asked them to tick boxes and waste time on bureaucracy rather than dealing with sick patients. It gave them no indication of how much they'd be paid. How could any business operate like that? It gave layers of extra supervision when they should be just engaged in looking after their patients. The issues of the gagging from criticising the HSE, which have already been highlighted, and many other issues which they would have viewed was an affront to their professionalism. And she finished the correspondence by saying, I leave this country to work instead in a system where the state respects its full-time workers. General practice, the one part of the health service that has been managing to function, albeit under strain, is being put into freefall by this measure. So you do have a big uphill battle to engage in these talks with the GPs, who overwhelmingly rejected the proposal so far. And if they are now to agree to it, I can only imagine that what you're proposing now is to stand on its head the scheme as you originally posed on it. But I would like to say that, and I do hope those issues are addressed and sorted out, but dealing with this and bringing this into being on top of the dysfunctional medical card system that we have at the moment is a wrong emphasis and a poor way of doing business. And this morning I had what can only be described as, I suppose, an hysterical phone call from a very upset wife whose husband has been in hospital for the past month, who's a fully Alzheimer's patient, and whereby that woman, while dealing with her husband in hospital, was facing the prospect at the end of this month their medical card was not going to be extended, allegedly because they didn't send in enough information. And when we rang to find out the information that this older citizen was asked for, the financial information that they wanted was copies of her house insurance, copies of her mortgage protection, a copy of her logbook for her car in relation to travel expenses, which she never claimed any travel expenses, a GP report which she already sent in, and they said that unless that was sent in the next 2 days, this woman who was dealing with a sick husband in hospital wasn't going to get that addressed. And I raised previously in the private members' debate on medical cards whether some of the dysfunction in this system is related to the fact that some of that work has been given to a German company, Arvato, to conduct the reviews. And incidentally, I would put it to you, Minister, that it has been alleged that one of the reasons why so much reviews are taking place now since 2003 is that the private sector IT department did a rollover on the computer because of a backlog in 2012 and ended up giving cards out to everybody, which meant that people who weren't entitled to them got cards, and that now the system is in free fall trying to claim back some of those cards, and innocent people who do clearly deserve it are being caught in the crossfire. Now, when I made points about Arvato being involved in reviews the last time in this House, the HSE put out statements saying that that wasn't the case, that they were only involved in data capturing, whatever that phenomenon is supposed to be. I would put it again, that is absolutely not the case. It is my contention that they are involved in the review of medical cards, and either you're not being told that or you're not telling us, because staff in the medical card system in Finglas are made up of a mixture of directly employed HSE workers and agency staff. I'd have to put it to you that the system is in complete mayhem. The agency staff who've been employed as a result of the public sector recruitment embargo and as a result of the changes in legislation, which means that they can't be discriminated against in terms of their pay, are actually costing significantly more, because not only do you have to pay them the same amount as the directly employed workers, but you've got to give the agency its cut of the profit as well. There are over 100 of them in that category. The Arvato staff who are dealing with reviews and have handled reviews had 1 day's training from the existing staff. And the existing staff are made up of some staff from the HSE and the public sector, some of whom were seconded from the likes of the Central Statistics Office and so on. I'm sure they're very good workers and so on, but statistics and reviewing medical cards are two entirely different matters. And these people did not get training. Now, when somebody in our system becomes a community welfare officer and assesses, for example, rent allowance, before they're allowed to look at anybody's form, they're given 3 to 4 weeks training. They have to sign the Official Secrets Act, they have to sign the Data Protection Act, and they have to be given Garda clearance before they can look or handle anybody's file. No such checks are in place with regard to the much more sensitive area of data and so on in relation to medical cards. And in actual fact, it's been put to me by staff who work there that Garda clearance isn't even looked for until the person is made permanent, and that happens maybe after 4 years. It is the case that there is a lack of training and a lack of an understanding of how the system works by the outsourced company, which to me can be the only explanation for why many of the most bizarre decisions which are being imposed on citizens are being made. And let's be clear here, these bizarre decisions are the difference between people being able to manage in their lives or getting an absolute blow that really knocks the stuffing out of them at a time when they're at their most vulnerable, when a loved one is sick or when they're dealing with a child with a severe disability and so on. Unless you address these issues, you will be judged on the basis of, really, to be honest, a callousness that no government has really stood over previously. And looking at issues or posing them like that you're going to bring GP care to all under sixes and lauding that as some sort of a stunt that people will buy into isn't sufficient at all. If you're serious about looking after the needs of children, you need to move urgently on those whose ill health requires an intervention now, no matter what age they are, and then get your act together in relation to bringing in universal health care for everyone else.